I think from the beginning of the COVID-19 pandemic, we saw very early on the disproportionate effect of COVID on the Latino community. We knew very early on that we needed to partner with community to really start addressing these disparities that were emerging.
Mostly because also this community were the most vulnerable and the ones who were showing the highest numbers of contagion. So we knew we needed to do something to bring equity and that inclusion and that justice to them who were suffering so much.
Getting out in the community to make testing as accessible as possible. And then on top of that, from our academic hat, we're trying to really have quantitative results that can show what inequities exist that have made response to COVID in some cases a challenge, but also how have we overcome those challenges and what kind of results are we seeing?
How do we have the support services that also help people in their day-to-day lives? The people who are benefiting from this project are people that are essential workers. So how do we think about those things to buffer the negative consequences outside of like just being ill?
We've been focused on COVID-19, but now we're trying to change our perspective onto what are the effects of COVID-19 on our community, what does our community need now. We're starting to think of new ideas to then continue on this engagement with the community, and some ideas are having behavioral health training, trauma response training. From what I've been seeing a lot from the community is that they have like a lot of emotions and traumatic events that have affected them from COVID. So now we're thinking about long COVID effects, not only physically but mentally.
There's a little bit about policy, and there's also a little bit about changing kind of like our group norms, that it is in our best interest in the long term to follow a lot of the COVID-19 guidelines. And in a way that's, protective not only oneself, but also for others.
We are all working together to have a pandemic response during times of COVID-19, particularly helping, taking care, supporting, uplifting the Latino community who has been greatly affected in these past almost 3 years of the pandemic. We do this together. We do it in English and Spanish, and it's a collaboration.